Welcome back to more psychology in my kitchen with Mrs. Ryan from Northview High School. We are continuing with the mood disorders, and in this video we are going to be talking about the persistent depressive disorder, which is formerly known as disemitic disorder. So in our last video we talked about major depressive disorder, in which a person has significant feelings of unhappiness, lethargy, worthlessness. And today we're looking at this one right here, this persistent depressive disorder, which was formerly known as disemitic disorder, which I tend to still just call disemitic disorder. So this is much less severe, okay? So it's another type of depressive disorder, but the symptoms are not as significant. So there is still the chronic low energy, the poor self-esteem, but those feelings being less so are not as debilitating, but the symptoms themselves tend to last a significantly longer period of time than what we see with major depressive disorder. So a major depressive disorder where we see that descent into the depths of depression, and then we ascend back out, and that total cycle typically takes somewhere between several weeks to several months. Disemitic disorder is this kind of overall down in the dumps, moody blues kind of experience that lasts for several years. And so not as significant as major depressive disorder, but still a depressive disorder nonetheless. Now, we understand that there are different types of depression depending on various experiences in our lives. We also know that women are much more susceptible to periods of depression than men. And one way that we know this to be true deals with women and their hormonal levels in terms of either menstrual cycle or with pregnancy. So here, I'm skipping disruptive mood dysregulation disorder because we're going to come back to that in just a second. But you'll notice that it states about premenstrual dysphoric disorder, or PMDD. Premenstrual dysphoric disorder is kind of like the most significant type of mood swing that could occur surrounding a woman and her menstrual cycle, and that this would take place either before or after she experiences her menstrual cycle. Now, lots of people make jokes about women and their menstrual cycles and how they might make them more emotional, and that's actually pretty normal, okay? But what's not normal are these significant mood swings that include symptoms of depression or anxiety that can occur in the week prior to a woman having her menstrual period or in the week after. And so when this becomes really significant, and again is including our 3Ds, it is deviant, distressful, and dysfunctional, we might then refer to this as PMDD, premenstrual dysphoric disorder. Along those same lines, we also know that women develop depression in terms of childbirth, and that sometimes we would call it the baby blues, for example. But this type of depression, or postpartum depression, as we might refer to it, there can also be prepartum depression as well, where women experience depressive feelings while they are pregnant, and more significantly after they are pregnant, that the body goes through such significant physiological changes that creates instability in the overall mood that this woman is experiencing. Now, good news with both of those is that because they are related to pregnancy, they often aren't going to last as long as our other types of depression might. And that's good news. However, being a mom myself, I can tell you that postpartum depression can be very significant, especially on new mothers who don't necessarily know what kind of resources are available to them, what could be beneficial to them. And a lot of people get kind of mixed up in the idea that, is this just kind of normal hormonal feelings that I might have after the birth of a child, or is this something that is much more significant? And that's why it's always important that anybody has conversations with medical professionals, their healthcare providers, about what are they feeling, what are the symptoms they're experiencing, and really advocating for themselves that if you think something is wrong, something is wrong, and you should seek out help for that. Being dismissive of other people's symptoms, which can happen, is counterproductive in our overall health. So then lastly in this video, I want to talk about this disruptive mood dysregulation disorder. This one is a slightly newer type of disorder that we start recognizing. And if I'll read here for you what it says. It says, severe recurrent temper outbursts manifested verbally and or behaviorally that are grossly out of proportion in the intensity or duration to the situation or provocation. Outbursts are inconsistent with developmental level and occur on average 3 or more times per week, with an onset before the age of 10. So what this is really talking about are temper tantrums, but significant and debilitating temper tantrums that occur mainly in children that are developmentally inappropriate. And this is something that in the school setting we see quite significantly with children who come into the classroom with verbal and physical behaviors that are harmful to themselves and potentially to other children. And sometimes we might use the terminology of emotionally disturbed, and that this is a child whose emotional experiences are swinging very greatly, and that they are being triggered by something either within themselves or in their environment that is manifesting itself into these huge outbursts that could occur at home or they could occur in the classroom. During these outbursts, you might see a child becoming verbally really abusive towards others. And what becomes more significant is their physical actions. So the child might become violent for experience. They might start throwing things, throwing chairs, running wildly like around a classroom or something like that. And so we understand that this is a child who is experiencing these recurrent outbursts that they don't have anything to do with discipline, right? This isn't a kid who, they're just acting out, they're being a normal child. And that's one of the ways where, this is really important that we start keeping track of how frequently these kinds of behaviors occur, because any kid is going to have a bad day where they have an outburst. And temper tantrums in young children are developmentally very appropriate because they become very overwhelmed with the stimuli in their environment. And so we look at how much more significant these kinds of experiences are for these kids. And again, we look at how frequently that they are happening, that if this is something that's occurring 3 or more times on average per week, that's really significant. And in the classroom setting, we recognize how debilitating that is to the state of learning. This is a kid who's not able to learn and preventing learning from happening in other children. So we're going to stop there for right now. In our next video, we are going to look at the bipolar disorders. So from my kitchen, we'll see you soon.